Hello everyone. This presentation is on Yu Ping Feng San, also called Jade Windscreen Powder. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Yu Ping Feng San is classified under stabilize and bind. A representative pattern is Qi deficiency with weak exterior and recurrent spontaneous sweating or frequent colds. Important ingredients include Huang Qi, Baizhu, Fang Feng. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 37-year-old woman with autoimmune disease and recurrent respiratory infections. The current medicines are prednisone, mycophenolate, metformin. This case gives a plausible reason to consider Yu Ping Feng San, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Huang Qi plus immunosuppressants. The mechanism is astragalus is immunomodulatory and may theoretically oppose intended immunosuppression. The clinical significance is potentially important in transplant or autoimmune disease despite limited direct clinical trials. My management plan is use only after approval from the treating specialist. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Huang Qi plus glucose-lowering therapy. The mechanism is astragalus may influence glucose regulation in experimental and clinical studies. The clinical significance is low to moderate. My management plan is monitor glucose in diabetes. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Baizhu plus diuretic or glucose-lowering drugs. The mechanism is atractylodes as diuretic and metabolic pharmacology in preclinical studies. The clinical significance is usually low but may contribute to additive effects. My management plan is monitor hydration, blood pressure, and glucose in susceptible patients. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Yu Ping Feng San may be reasonable when the patient's presentation matches Qi deficiency with weak exterior and recurrent spontaneous sweating or frequent colds. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula List, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.